this is one where we freaked out. So the patient presentation, like suicidal, self-harm, is at imminent risk for significant self-harm or significant harm related to continued benzodiazepine use. I don't think cold turkeying a suicidal patient is going to make them less suicidal. It's just not. That's ridiculous. Patient symptoms or co-occurring physical or mental health conditions cannot be managed safely in the outpatient setting. Seizure disorder. I don't know anything about seizures, so I'm not going to say anything about that. The patient is experiencing or imminently anticipated to experience severe or what does that mean? You're going to experience severe or complicated withdrawal. The patient has a history of severe or complicated withdrawal. Okay, this is where they're talking about us, and they're basically saying to send us to detox because we're complicated, and that doesn't make any sense. And again, if you're going to speak out, page 7, line 25, this does not make any sense. I feel like almost when I was reading this the first time, I know it sounds like I'm just reading it the first time, but I promise I'm not. I just don't have a good memory. The first time I read this, it was like they're sending people to fantasy detox. Like, this doesn't exist. There's not an inpatient facility to manage complicated withdrawal. We would have all went if there was. So there's no value in this to me. And again, it's clinical consensus. It's not from evidence. It's a strong recommendation. And it doesn't make any sense if you have a history of severe or complicated withdrawal. You should be sent inpatient care. And I don't even know if they're talking about like a psych facility or detox, but I know that there is no facility to send us to. I think all this does is get you out of that prescriber's lap and out of their problems and passes the buck somewhere else, to your detriment, because then if you get harmed or die from there, they're not going to track outcomes, and they're going to keep this recommendation no matter what. It's very dangerous. So again, this is one that I would highlight. If I had like the top 10 to highlight, this is pretty high up there.